What is the link between testicular shrinking and cancer risk? Imagine noticing that one of your testicles feels smaller or different. You might wonder if this change is normal or something to worry about. Testicular shrinking, also called testicular atrophy, means a decrease in the size of one or both testicles. While it is not a direct cause of testicular cancer, it can sometimes be linked to conditions that increase the risk of developing cancer. Testicular atrophy can happen for many reasons. Injury to the testicle, infections, hormonal imbalances, or previous surgeries like testicular torsion can cause the tissue to shrink. Testicular torsion is a twisting of the spermatic cord that cuts off blood flow, and if not treated quickly, it can damage the testicle. Damage from these causes may sometimes make the testicular tissue more vulnerable to abnormal cell growth, which could potentially lead to cancer. Men who have experienced testicular atrophy are often dealing with underlying health issues. For example, infertility is a common condition associated with testicular shrinkage. Interestingly, infertility itself is considered a risk factor for testicular cancer. Men with a history of undescended testicles, a condition called cryptorchidism, are also at higher risk for both atrophy and cancer. These conditions often share common causes, such as developmental problems or hormonal imbalances during early life. In some rare cases, testicular cancer can cause the testicle to shrink. Usually, testicular cancer presents as a painless lump or swelling, but if the tumor affects the testicle's normal function, shrinking might occur. If you notice any change in the size, shape, or feel of your testicles, it's important to see a healthcare professional. Early detection can make a big difference in treatment success. Looking at the bigger picture, changes in reproductive organs, whether in men or women, can sometimes signal underlying health risks. For example, in women, abnormal changes in the cervix or irregular bleeding can be early signs of cervical cancer. Similarly, in men, noticing testicular changes like shrinking, lumps, or pain should always prompt medical evaluation. To sum up, testicular shrinking is not directly linked to causing cancer, but it can be a sign of underlying issues that raise the risk. Conditions like injury, developmental abnormalities, or infertility are connected to both shrinkage and increased cancer risk. If you see any changes in your testicles, don't ignore them. Consulting a healthcare provider is essential for proper diagnosis and early intervention. Remember, early detection and appropriate medical care are key to managing both testicular atrophy and testicular cancer effectively.